Yeah, we're so excited about this nomination. Dr. Davis and Dr. Moore are not only staff physicians in both of our ERs, but they're also our medical directors. And a lot of times people wonder, what does that mean? So essentially it means they're in charge of the physician groups. And so they help with anything from staffing and scheduling, but they also become leaders for us. And I think that really the unique thing about both of these physicians is they are leaders within our medical staff, within our departments. And certainly we can't talk about them without talking about COVID and the past 2 years and how both of them were working together to be creative, to talk about ways that, especially at the beginning, how can we treat these patients and how can we also keep our staff safe? And so they really work together with each other and with our teams to be able to provide that care, and sometimes in an innovative way that maybe we wouldn't have even thought about before.
And so Jennifer mentioned the pandemic, and we know that we all struggled through that. And our physicians, these two physicians that we're speaking of, did an amazing job at, like she said, keeping our staff safe, keeping our patients safe, coming up with creative ways to keep them separated, but also to be able to take care of that regular emergency patient, that heart attack, that stroke, that I fell and broke my arm or I need stitches, and coming up with ways, to do that in a manner that it was safe for everybody. And one thing that I just really appreciate both of these physicians for doing is no matter what's going on, they both have a great attitude. They're there to pick each other up, to pick the nurses up, to give that pat on the back that's needed when, somebody may be having a bad day. And they're both just really great at, giving us inspiration to keep on going when the times get hard.
For me, it's taking care of people. It's seeing people when they're very vulnerable. Sometimes they're in pain or they're very, very sick, and it just really means a lot to be able to take care of them and hopefully help them. It's been tough on society, but also tough in the hospital, and I'm thankful that we've seen a bit of a break here with not as many illnesses, but I think it's still important to watch yourself and watch your symptoms.
Privilege being nominated for this. Oh man, I've been doing this since I was an intern, dating back to 1997. Kind of gravitated toward this specialty through time. I enjoy the complexities of it, some of the nuances, the ability to take care of many different people, many different age groups, many different backgrounds with many different problems.
I've had the pleasure of working with both physicians at the bedside, and I've witnessed on many occasions how they communicate with the staff and with their patients. They often have to deliver, some news that's not very good sometimes, and they do it in just such a manner that it a lot of times puts the patient at ease and comforts them in knowing that this physician actually really cares about me as a person, not just a number, but as a person. And so they are just really great at putting the patient at ease.
It's not just us that think that Dr. Davis and Dr. Moore are heroes. Our patients tell us that.
All the time.
They continue to be named in our patient satisfaction surveys. They tell our staff. They tell our physicians how wonderful they are. So there's a lot of people out there that think they're heroes.
Absolutely.